How to get rid of sharp pain under left breast? Pain under the left breast can mean a number of things depending on its cause. There are numerous different causes for pain under the left breast, including heart-related issues, digestive causes, and breast-related causes. Organs in the upper left section of the body include the stomach, heart, lungs, ribs, colon, pancreas, and spleen. Pain in the left breast may go away without treatment. However, it may also be a sign of an underlying condition that needs medical treatment. A person should see a doctor if they experience trauma to the breast, sudden or severe pain, swelling or tenderness that does not improve, or shortness of breath accompanied by breast pain. Treatment options will depend on the underlying cause. For example, if the cause is indigestion or acid reflux, a person can try resting and taking antacids. If someone thinks they may be having a heart attack, they should seek immediate medical attention. Pain under the left breast is often frightening to experience. Early diagnosis will increase the chances that treatment and recovery will be successful. A heart attack is not the most common reason for pain under the left breast, but it is always better to have the symptoms checked out, especially if other symptoms of a heart attack are present.